Good day, good people. It's that time. It's time for Tip Tuesday. Come on in, come on in. It's Tuesday. My name is Nikedra Brown, the nurse practitioner who teaches you on ways to get and stay healthy. I come to you on Tuesdays with Tip Tuesday. So come in. As you come in, if you're watching on replay, hashtag replay. I see Dwayne from Texas is in the house early. Hello. Go ahead and shout yourself out as you come in. I'm not always able to see all of the viewers, so I would love for you to say hello. Let me know where you are viewing from. And it's Tip Tuesday, so let's go ahead and get into this thing because I'm not going to be here with you too long today. Let me know if you're here, if you can see this and read it correctly. I always have to double check my mirror image when I'm going live. So let me know if you are able to see that. Give me a thumbs up. Yes, in the comments, something so that I can know that you are able to read a Tip Tuesday with Nikedra. So y'all come in. I know it's outside the normal routine for some people. I'm actually not at work as I normally am with Tip Tuesday. So in an area of my house that is my quiet space, the place where I kind of get my thoughts. So just let me know if you are tuned in, if you can read this correctly and that is not in mirror image, and we will head on with our Tip Tuesday. So hello to those who are hopping in. It also helps me to check my delay when you put some comments down below. So Tip Tuesday with Nikedra for those who are hopping in. Yes, Miss Vivian, appreciate you. So glad to know you are reading that correctly. What are we going to talk about today? It's World Health Day. I bet you didn't know it. It is World Health Day. Let's get a coronavirus update, and we're going to talk about quarantine at 15, all right? So let's hop right on into it. Before we get there, let's do some announcements. I see Ola is popping in. Hello. Announcements. Cost. The cost to attend my Tip Tuesdays is to interact and to share the broadcast. So if you haven't already, make sure you're sharing this broadcast out so people can see my Tip Tuesday on your news feed, and tag a nurse. So if you know any nurses, we're going to have an opportunity to tag them. You can go ahead and do so now so they can hop in if they have opportunity. And we are going to stand in virtual line for Club 550. So if you haven't already gotten your virtual ticket to stand in line, www.NikedraBrown.com. That's how you do that. So I'll let you know more about Club 550 coming up. But yes, I am outside of my normal today, Dwayne. Actually at home. It's supposed to be spring break for the kids, but since we are out of school, their break is indefinite for now. But I still went ahead and took some much needed time off. So tell me what you've been doing while you have been on a stay-at-home order. Are you in a state that has a stay-at-home order? Let's have some conversation and kind of catch up while we're in here together. I love seeing some familiar faces when we hop in for Tip Tuesday. So hello, everybody. What you been doing while you've been on this stay-at-home order? What state are you watching from? Go ahead and put what state you're watching or viewing from in the comments. Does your state have a stay-at-home order in place? I know some do not. I am in North Carolina, and yes, we actually do. So what have you been doing to kind of buy your time? Again, I'm not in clinic. You're used to me coming to you Tip Tuesday in clinic, but this was supposed to be the kids' spring break. And so instead of being on spring break, we are actually quarantined. We are actually on a stay-at-home order. I think they just went outside to ride bikes. So if you so happen to hear a burst of energy come into the room, it is them. That will be something a little bit different. So if you are just tuning in, I went over the announcements. The cost for watching Tip Tuesday is that you share out the broadcast. So you got to make sure you share this out and you interact with me so that I know you're here, so I know you're getting this information, and so that I know it's helpful. We're going to talk about World Health Day. We're going to talk about the coronavirus, and we're going to talk about quarantine 15. So my coronavirus conversation is not going to be your typical coronavirus conversation because I feel like you get enough of that, right? And so I see some yard work in Virginia is being done. Yes, so let me know what else you all are doing while you are on a stay-at-home order. It's beautiful here in North Carolina. So hopefully some more people are getting up, getting moving. Hey, Sheila, let us know what you are doing. So while you're dropping those comments, Let me know how you would describe your current state of health. How would you describe your current state of health? Would you say it's great? Would you say it's good? Would you say it's poor? Again, just an announcement. When you come to Tip Tuesday, this is a no judgment zone. We ask for interaction, but it's not to judge you. It is merely just to get some interaction, see where people are. You'd be surprised that people are exactly where you are more than not. They just don't often say it. So if you are watching, let me know how you would describe your current state of health, because we're talking about today is World Health Day. Today is World Health Day. So what is health? It's a state of physical, mental, and social well-being. A lot of people think of health as being just physical, but your health is more than your physical. It's your social, it's your mental well-being. What does one need for a healthy life? So those of you who are saying your health is good, why do you say your health is good? What does one need to live a good life? What does one need to live a good, healthy life? We talk about having balanced diets. We talk about having appropriate weights. We talk about having normal blood pressures, getting some exercise, avoiding excess smoking and drinking, things like that. But what would you say you need for a healthy life? Are you somebody who takes your health for granted? Because quite often we find people who say they're healthy, and that's only because they haven't had any health events, right? You've not had a heart attack. You've not had a stroke. You've not had anything catastrophic to happen. But let's be honest, you aren't doing a whole lot to kind of protect your health. It's just that good fortune. It's just that grace. It's just that mercy that you haven't had one of those health events yet. And so lots of people will take their good health. I see y'all are putting good in the comments. Again, if you're hopping in, let me know if you will classify your health as great, good, or okay, or poor. And think about this. Do you take your health for granted? Are you genuinely healthy and you don't really work at it? Be honest. You don't watch what you eat. You don't really get any exercise in. If that's you, let me caution you. You want to make sure that you don't take your health for granted. You hear me say all the time that health is wealth. It absolutely is, because a lot of times you will take your health for granted. The fact that you haven't had any health diseases, the fact that you don't have any heart attacks, strokes, or anything else catastrophic. You think, okay, I'm healthy, but let me let you know that you shouldn't take your health for granted. You must live a balanced life. If your body is good, but your mind is stressed, that could actually be causing more detriment than you know. Again, a lot of people think about your physical health, but not your mental health. Being in good health is so much better than being in bad health. So I often relate it to a car. You want to make sure your car is having standard maintenance. You don't want to wait till your car breaks all the way down before you take it in to be tuned up, or before you take it in for a service. Otherwise, they're going to find everything in the world wrong with it. So you want to make sure that you tune your body up and that you keep it tuned up. I see my mama in the broadcast, y'all. Hello, hello, hello. Hey, Wakanda, thank y'all for tuning in. Make sure you share out the broadcast and we interact here. That is your cost for attending Tip Tuesday. We're talking about World Health Day, April the 7th. It just so happened to fall on Tuesday this year. I'm excited about it. It's World Health Day. We have World Health Day every year. And this year, guess what our theme is? The 2020 theme of World Health Day is to support nurses and midwives. So if you've been here with me since the beginning of the broadcast, you know I said you were going to have an opportunity to tag a nurse. So this is it. If you know any registered nurses, if you know any advanced practice nurses, if you know any nurses, this is your opportunity to tag them and just say thank you. So just put the @ symbol and their name that should tag them and say thank you, because we're going to collaboratively thank you on this broadcast. Thank them for their service. That is the 2020 theme for this year for World Health Day. We know a lot is going on in the world, not just the United States, as it relates to coronavirus, as it relates to lots of other things. And so we want to make sure that we are tagging our nurses. All right, Wakanda, you are too embarrassed to talk about your health. All right. Dwayne is saying he's in good health, but you need to get back on your health and your exercise routine. So quite a bit of few people, your routine is all thrown off. And so it's not uncommon for you to be doing different things, especially since you are socially isolating, you are quarantined, you're on stay-at-home orders, as I said. If that's you, go ahead and put in the comments if you are watching this from a state that you are on stay-at-home orders. Here in North Carolina, we have some stay-at-home orders, which is why I'm at home today, y'all. I'm not working, took this week off for spring break, but since the kids are out of school, guess what? We're at home. And so, again, this is your opportunity to tag some nurses in this broadcast. I see Wakanda is tagging some people. Thank you, thank you, thank you, thank you, Ms. Johnson, for tagging people into the broadcast, nurses. We want to make sure that they are aware, maybe having boots on the ground so fast and so much that they don't even know that today, April the 7th, is World Health Day. This year's theme, the theme changes every year, but this year's theme is to support nurses. We all know one. You all know a nurse. Tag her or him and say thank you. It also supports midwives. So that is the theme for World Health Day. Let's talk about You Health Day. Okay? Let's talk about you. The world is important, but right now we're going to talk about you. So I want you, if you have to watch replay or if you're watching this on replay, you got your little sketch pad out because you're really supposed to be at home working right now. Go ahead and put this thing that I want you to work on for you. You already confirmed that you can read this, so come on with it. Write 3 good and 3 not so good things about your health. This might be your physical health. This might be your mental health. All right, Binky, come through. You said your health is not too embarrassing to talk about. This is your opportunity to write to yourself. What are 3 things? 3 things that are good, 3 things that are not so good about your health. These might be physical things. These might be mental things like, yeah, I'm always stressed out. Or, yeah, I find that I'm getting more anxious. Or I'm not really sleeping. To, yeah, I know I need to lose weight. My blood pressure is up. As Dwayne said, not getting enough exercise. What are things? Come through with the nurses. Yes, yes. What are some things that you know you need to work on? And the second thing is I want you to plan. We talked about World Health Day, but this is you. What do you need to do? Plan. How will you change the things that you wrote that are not so good? Because an impossible plan is what? It's impossible to follow it. You can see behind me, I got to think it. I got to plan it and I do it. That's what I do. You just don't get up and kind of expect that you're going to have instant results. There's a plan behind the process. So plan how you're going to knock out or get these not so good things about your health in order. And who can help you get there? Who can actually help you get there? If you are just hopping in, this is Tip Tuesday. I am Nikedra. We do this thing on Tuesday where I give you tips on ways to get and stay healthy. We're knocking out our checkoff list for this week. We're talking about World Health Day. And I skipped over and talked about You Health Day. So these are things I want you to jot down. Make sure you do them, right? Because a lot of times we put a list of things to do, but you don't actually do them. Write these things down and actually do them for you health to make sure you are staying on track with you. You got it? Let me see a thumbs up in the comment if you got it. Yes, yes, yes. You got to make those plans. Nobody else can make them for you. You have to do it. Let's get our Corona update. Okay, you hear about it on the news every day. So I'm doing a check-in, right? I'm not going to talk to you about what it is you see. There's a lots and lots and lots and lots and lots and lots of stuff. I did a Corona virus live last month. Scroll down on my news feed. You'll find it. Had about 7,000 viewers. It gave you some basic information about coronavirus. The numbers in that has changed, but the actual information is the same. So if you really need a down and dirty on coronavirus, you should scroll down my news feed and look there. But let me check in with you. How are you feeling? We got some introverts. We got some extroverts. Introverts are people who like to stay in. So this self-isolation and self-quarantine might be good for them. We have extroverts on the other side. These are people who like external physical touch. They like to be outside their house. And then we have these people who are kind of in the middle. Where are you? Where are you? Because being forced to stay in your house is sometimes more difficult than we would admit. A lot of times we would say, oh, I just rather be home. But now that you are on a stay-at-home order, how does it feel? How does it feel? How has it changed your routine? Dwayne has already said he's not able to work out. His whole schedule has been changed. Some of you are working from home. Some of us are homeschooling, right? That's not what I do. So that is a whole change in my environment. So let me know what is different about you. Let me check in with you because we just talked about health is mental and physical. Let's do a mental health check-in about what this quarantine, this stay-at-home order is doing to you, okay? I see the nurses still coming through. Thank you if you are hopping in for your service, especially on World Health Day, but every day. Y'all know I am a nurse, and then I'm a family nurse practitioner, and so nursing is near and dear to my heart. Let's talk about this social isolation. Y'all still going to the store? You still having cookouts? Because it's hot. You still planning that Easter Sunday dinner with 20 of your family? What is social isolation? What does it mean to socially isolate? Right? You need to start considering that, reconsidering it. I'm in North Carolina again. I was listening on yesterday. They come every day, probably wherever you are to, with an update. Just talking about where we are. And they said that if we were to stop the social isolation that we have put in place since April the 30th, until April the 30th, we would probably see an increase in the amount of cases that we see. So that's a precursor to letting y'all know that you're probably going to be in the house longer than April the 30th, right? The way we are helping to contain the spread of the virus is to get people from being out shopping in Target, in Walmart, at the gas station, at the grocery store. Unless you have to, it should be absolutely necessary. Otherwise, you need to be where? At home. At home. Let's talk about the numbers for just a minute because I got these numbers this morning. 360,000 cases in the United States. Now, you know that's fluid because as soon as I recorded that number, there was another diagnosis, right? 360,000 cases in the United States that have been documented with a test. Let me add that. There are people who are being required to self-quarantine. There's no indication to test every person. So we know those numbers probably are higher. But 360,000 positives. Of those, 10,000 deaths. So when I gave you my first coronavirus talk, I talked about numbers and deaths. And again, any death is still a death. And we definitely mourn. And we are in prayer for the families. However, I wanted to give a little perspective again. Out of 360,000 people who are diagnosed, there are 10,000, somewhere thereabouts, deaths. Again, those numbers shift. So how much is that? Where are my mathematicians? Where are my math scholars? How much is 10,000 out of 360,000? Well, I know 36,000 is 10%, right? So that's about 3% by my calculation. If I'm not right, somebody let me know. So about 3% out of all the cases that you keep hearing about on the news, that you keep hearing about on CNN, that you keep hearing about when you turn on your local news, out of all the cases, only about 10% of those have actually died. Okay? So it helps to bring it into a little more perspective because it seems like you are only hearing about people who die or about bad things. We want to shift on Tip Tuesday to the positive. Yes, there have been some people who are diagnosed. 360,000 people. There's some people who have been mildly affected, and we don't even know those numbers. Why? Because they recovered. Because they're doing good. Because they didn't need to be tested. So we don't know those numbers. Hey, Brenda, we don't know those numbers. Y'all, my nurse just showed up in the broadcast. Brenda, we gave a shout out to nurses. It is April the 7th. It is World Health Day, but World Health is saying kudos to all the nurses in the profession. So kudos to you, ma'am, for serving with me for so long. I appreciate you. Love, love, love. I see Miss Diane just hopped into the broadcast. Again, I'm doing my coronavirus update. I think most of you here watched that initial broadcast We've already talked about World Health Day, but let's get back to these numbers because I need to shift to the positive. I need you all to shift to the positive. I need you to get your mind. We just talked about health. It's physical and mental. You got to get your mind off of the negative. You got to shift your mind to the positive in this, right? Got to shift your mind. 360,000 people of the people we know that have been diagnosed. Not everybody has been diagnosed. Of those people, 10,000 people of those have died. Again, not minimizing the death of anybody, but that's 3%, y'all. That's 3%. Where are my mathematicians? Where are my scholars here? That's 3%. So the news gets so caught up, they get your mind wandering, they get you staying up at night, they get you stressed out. About 3%. Okay? 3%. Think about the other 97% that are on their way to recovery. The other 97% that are back in their homes, that are living their lives normally. Think about the other 97%. In North Carolina, we've had 2,950. Again, that's just by my collection of data. Before I did this broadcast, it changes. And there have been 45 deaths in North Carolina, right? 45 deaths in North Carolina. That keeps us about in line with the average. So I want y'all to shift your mind from the negative. Think of the facts. Continue to think about the facts, right? Get your mind out of hearing everything as relates to corona. Not everybody who you hear that has corona is going to die, because you will know somebody now. You will know somebody who is and has been affected, but 97% of people, what? They make it out. They make it out, right? We're looking at a 3%, 10,000 deaths. Again, that may change. By the time this broadcast goes replay, it might change from there. They are expecting this week to be the toughest week as it relates to corona, right? This has been the toughest week as it relates to corona. And I saw a powerful post, y'all. It was so powerful to me. It said the CDC and the government is saying that this will be the toughest week as it relates to corona. But guess who else had a tough week this week, y'all? Jesus. Yes. It was so powerful when I saw it. They talking about corona is going to be at an all-time high this week. This is going to be the toughest and most difficult week. This is Holy Week. So who else had a tough week this week? Yes, Jesus. So we need to get our mind off of all the negative as it relates to corona and get your mind on the positive. You got it? I got some sheets about corona. If you want some of this, so you will know the facts and not the myths, you can send it to my inbox and I will email you. I cannot upload files onto my personal page, but I got them if you need it, because I need y'all sharing facts and not myths, not hearsay, not I thinks. I need you sharing your facts. I was going to talk about a couple more things before I got carried away. Face coverings. So the CDC is now recommending face coverings. Holy Week, Brenda, yes. Face coverings. I missed it, Dwayne. You said, thank you. You are so welcome. Face coverings. So the CDC, if you don't know what CDC, it is the Center for Disease Control. And I came to you, Dwayne, because somebody shared. Somebody on your news feed shared me. So if you're watching me like right now, the cost for you watching me and getting this Tip Tuesday is that you share. So just like Dwayne said, people can get this information and they will be able to apply it to their everyday lives. I need y'all walking with knowledge. I need y'all educating and informing others. I need you to stop all the talk about the negativity and to make healthcare, people learning and knowing about their health, be a positive experience. Face coverings. You should be covering your face when you're going out. We have heard about the shortage. N95 masks, our surgical masks, they are in short supply. Yes. So we do need to be saving those for people who are on the front line of duty. That would be medical staff such as myself, all my other nurses that have been tagged in the broadcast. They need those PPE, we call it. But you should be covering your face. And so CDC has several lives. They have gone live with ways you can make a simple face covering, right? It's just a covering for your face so that you can help to stop the spread of illness. Now, is it filtering like the other masks? It is not. But we have some asymptomatic people, which means they are actually carrying the disease and they are actually sharing it with others because they are not socially isolating, right? They are still going over to people's houses. They're still going out to stores. And so because that happens, we have some asymptomatic people. And so something is better than nothing. You're going to put a face covering on to help. If you are asymptomatic and you can pass on the virus, that's going to potentially decrease that. And it's going to limit the contact if you have one on and somebody is around you who is asymptomatically shedding. You got it? But it doesn't filter. So you can use whatever you want to. You can use an old scarf, bandana, t-shirt, fabric that you had from whatever it was you were supposed to make a long time ago. Use it to make a face covering. There are plenty of, just scroll, CDC has some videos about how to make one. I was going to do one, but guess what? I can't find no fabric here. Where is anything when you need it? I call myself putting my stuff up so my kids won't get it. So I'll know where it is when I get ready to go to it. And guess what? No, I can't find it. So I was going to do a demonstration during this video. But yeah, that's not going to happen because I didn't find any fabric. So anyway, I'm going to send you back to CDC. If somebody has one on their news feed, you can put me in the comments right now so people will direct to your page. And then maybe I'll try to find a YouTube video and post it in this link. That's what I'll do. I'll post a YouTube video in this link. It's super, super simplistic. Just need a piece of fabric, 2 rubber bands, or even some elastic bands. So I went out and bought some elastic bands that I put in my little girl's hair. And you can make it with those. So super, super simplistic. You just need to cover your face when you go out. Okay? Last topic and then we're out of here. Quarantine 15. Who has the Quarantine 15? I bet some of you have it right now and you don't even know. What is it? It's the 15 pounds that you have gained and are gaining since you've been on quarantine. Since you have been inside your house. Since you had a stay-at-home order. What are you doing to avoid it? Because you're out of your routine. You're not going to work. The kids aren't going to school. You keep going to the pantry and the refrigerator. And you're snacking. What are you doing to avoid the Quarantine 15? Put it in the comments. Let me see what you're doing. Because if you don't do something, guess what? You're going to find yourself up 15 when you get out of quarantine. So what are you doing to avoid the Quarantine 15? If you haven't been watching me and following me closely, you should be standing in a virtual line for Club 550. So what that is going to be is a chance for you to avoid the Quarantine 15. We're going to have some step-by-step ways to get your body moving, ways to get you grooving, and back in your normal state of health. www.NikedraBrown.com. You can get in line there, put your information, and once the info is available, I am still waiting for the construction to end. Once the construction ends, then I will send you information if you desire. But you have to go to www.NikedraBrown.com and get on the list. All right? Intermittent fasting, somebody's saying. Less eating. All right. So I see it. There are some people who are trying to avoid the Quarantine 15. If you are just hopping in, we've gone through our series of Tip Tuesday topics. So you're going to have to watch the replay. #replay if you are here. There's been so much that I've discussed this week. I see it coming in about what you all are doing. You're jogging. You're walking the steps. You got to do something. You want to avoid the Quarantine 15. It's much easier to get the 15 than it is to lose the 15. You got it? All right, let's see what else I got on my list. Because otherwise, I said I wasn't going to be in here long. My husband is sending me a text message. He knows I'm on live. Go figure. But let me see what comments we have here. Questions? I'm not at work this week, y'all. I took the week off for spring break. Kids are here. Husband is here. They're outside. They probably want me to come outside and socially isolate with them as they're riding a bike. So, hey, this is actually, surprisingly, it's actually been interesting because, for spring break, you make these plans, the kids out of school, you kind of coordinate if you're out of work. And it was so refreshing yesterday to not have to do anything. Didn't have to pack any bags, any lunches, didn't have to drive or go to the airport. We were just at home. Didn't have to think about it. Like, what are we going to do? Where are we going to go? Kids arguing. Now, they're still arguing at home, though. So it was surprisingly non-stressful. So in thinking about your health, that's one of those things that took some of the pressure off unknowingly, right? Because we didn't have anywhere to go. Didn't have anywhere to be. No time constraints. Eat. Go outside. Watch TV. That's it. Like, that's the life, right? So whatever works for you. All right, y'all. So that is all I have for you. If I don't have any questions, I'm going to hop off, go outside. It's a nice day. I'm going to get it moving, get some steps in for the day because I am behind my norm for this time. So go ahead and get some steps in for this day. And you're eating cleaner, Chloe? Perfect. That's good. That is good. It's a good time to reevaluate your health, what it is that you do, what are you don't do, what are you not doing, what are you don't doing, what are you not doing, and go from there. So if you hopped in late, we talked about what are you going to do for you on World Health Day. Tagged a bunch of nurses in the broadcast because it is World Health Day and the WHO, World Health Organization, is giving shout outs to the nurses. So I hear some footsteps coming up the stairs and they're about to come through the door in 5, 4, 3, 2, 1. See y'all. Bye.